Put It By The Wall is the number one podcast nowhere in the world.
Yeah, I mean, at least this is where they come to be inspired and motivated, my brother.
Okay, you're not lying. You're not lying.
Amen.
Welcome back to another episode of Put It By The Wall, the number one podcast nowhere in the world.
Nowhere.
Look, it's a running joke for now, no? But one day, I promise you.
Until
then, we've got a spectacular guest, a great
She
guest.
saves lives
Not just
every
a great
day.
guest, but a great person as well. So, today we've got Mrs. You always forget your name.
Cherice.
I'm thinking of how nervous she is, and it's making me nervous. What's going on? Okay, so today we've got Cherice de Villiers. She's a clinical nurse consultant.
Not all heroes wear
She's
capes.
not only a nurse, she's a mother of 3 beautiful daughters and a handsome husband. Hey.
It would be nice. We just cut through to that.
Yeah. Cherice, how are you?
I'm good, thank you.
Lovely. So let's just dive into the deep end of it, man.
One
Instead
time.
of doing all the formalities, just tell us a little bit about yourself, your work, and your bit of your personal life and that kind of thing.
Okay. I work Monday to Friday,
Mhm.
8-hour shifts.
Mm.
No more night shifts for me.
Mm.
When you have that title.
Okay.
Oh, yeah.
Oh, on the fancy.
Yeah. So, yeah, and then I'm a mother of 3 beautiful daughters.
Mm.
Wonderful husband, great support for me,
Mm.
especially when I was doing that studies
Mm.
for
can
this
imagine,
title I
yeah.
have now.
Yes.
Yeah, and then I like listening to music, dancing in the house, of course.
I was just
singing
about
in
to
the
ask now,
house.
where's the demonstration?
Yeah, and that is basically it.
Mm.
Yeah.
That's nice. Your kids ages?
15, 13, and 3.
Oh, you got like all the hectic ages there, bruh.
Yeah. Like all the levels of education.
All of it.
Mm.
Oh, they all over the show.
Mm.
That's nice. So, in terms of like I said, you were a superhero, a real life superhero. I know we kind of use the term loosely, no? I will tell you-
Society.
in society, I'll tell you why. Because we had the other lady here, Julie. She's the head of the Arthritis Foundation of South Africa, and we were speaking a bit about what she does and how she goes and go do the community work. And you know the people that comes out to the houses and come and what do they call them?
The home-based carers.
Home-based carers.
Mhm.
So we were speaking about the home-based carers, the nurses, and the people that is actually on the front line doing the work. And if that's not the epitome of superhero, then I don't know. Because I mean, at the end of the day, you tired. You're dealing with your own life situation. You have children, and then you come to work and you do your thing there. And on top of that, when you guys go home, you go do your mommy and wife duties and stuff like that.
That's new.
So shout out to all the women doing your things and all the husbands that support them. So tell us, how does your 9 to 5 look? How does your typical day look?
Well, previously, I've been working in the new club most now for 2 weeks.
Mm.
It's much more dialed down.
Okay.
But the other clubs I worked in, very busy.
Mm.
We have like 180, almost 200 patients for the day,
Mm.
booked patients. And it can get very hectic. You know, some verbal abuse from the patients.
Mm.
Have a lot to say there in front of your door waiting to be
I
seen.
have a
and
question about that.
yeah, all of that. But then, you know, when you don't, when you're used to it, it doesn't get to you
Yeah.
anymore.
Mm.
So you're just there to do your job, do the best that you can,
Mm.
and try to get them out. Just get finished so they can go.
Walk the line away, yeah.
Yeah, because they want to go home. They don't want to sit
They
there all
don't,
day.
yeah.
100%.
Yeah.
Yeah.
So by the time it's almost like say so an hour before home time,
Mm.
I just finish off with all my admin work,
Mm.
and then I go home on time. There
Goodness.
is some days where I stay a bit longer,
Mm.
where maybe I had some difficult patients I had to discuss with
Yeah.
doctor, and then it takes longer, and then I'm there a bit longer.
Okay.
Yeah,
Okay.
but I always leave the admin for last.
Yeah.
Mm.
Okay.
I personally don't like admin at all.
I love it.
Paperwork.
It,
Oh, I hate it.
it works. For me, that's where we differ
Tedious
now.
work.
Yeah, is what it is. Cherice, you wear a lot of hats from what you just heard now. Mother, nurse, okay, not nurse, what? Nurse, practitioner, consultant. No? Or something to that.
Almost.
Something to that effect.
Almost not.
You a mother. You said you're a woman of faith. I want to know is, what's the real, when all that is away, when there's nobody looking, who are you really? Without who are you on the inside?
Mm. I'm a very kind person.
Love it already.
I'm friendly.
There
I'm
we-
calm.
You have to be.
I can tolerate a lot. I have a lot of patience. I also have other side of me where people don't really see it much. You really had to now do something where you get that side of me,
You must push all the buttons.
Yeah. And then, I like being not alone, but, me time.
In your
Yes.
in your own bubble, yeah.
Yeah. I love my house, being at home, not going anywhere, being in the house. I love that,
I think that's a for me as I'm getting older now. So that is what I want to do. I don't want to go. I don't want to pay to go somewhere where I'm gonna enjoy myself for an hour and I'm tired again. I would rather pay to sit here at home and I know I can get into my bed whenever I
And
want.
just relax.
Yeah.
Do you think it's the age that's getting us? Or have you just always been that way and it's just us? It's the age is catching up to us now.
You see, you changed the whole question now.
No, it wasn't always that way. I also wouldn't say it's the age. I think it's for me personally, I think it's what you've been through. Childhood and young adult, and then you just come to a point where you are mature. Like sometimes
Okay, yeah, fair enough.
before the time. You
Yes.
understand what I'm
Fair,
saying?
yes,
100%.
And then you just, you
Okay.
don't feel for these type of things anymore.
I think we have
Just ate a party.
we
Yeah.
we have partied enough to say the
Yeah.
parties can be tired now.
Look, I think also when we have this kind of conversation and we talk about being at home and I like being secluded and like being in my own space. And this is something that I want to refer to Taryn. Taryn, if you're watching, I'm talking about you. Is you remind me of Taryn, like in this setting right now, she will be very reserved and quiet. But when you're in your house
When you
and
know-
you're at your most comfortable and your shoes is off, and then you're very bubbly and that personality shines. That exact
Yeah.
question that he was asking early on. When he asked you the question, I saw it. I pictured you like that. And she is genuinely very kind and nice.
No,
and all
I
this
can
other
see,
thing.
man,
I haven't
I
seen
can
the other side. But
Let's hope we never do, no?
but when you say you like being in the house and you like me time and that kind of thing, is it just in general like parties and lots of people and stuff like that, or do you like enjoy nature like mountain
Hiking,
not climbing,
stuff like that.
hiking, go to the park and those kind of things,
Mm.
or do you just stay away from everything?
With it.
I love nature, but I won't go hike.
I like looking. You like looking at nature. No?
Yes,
I'm with you.
I
I'm with
will-
you on that.
It's as far as it goes.
Yeah, go in my yard or
I'm-
like that. But I think I'm every day between a lot of people at work.
Makes sense, no?
So
You
when
don't-
I'm home, I just want
Don't smack, so.
my kids is enough.
Mm.
They already making a
Teenagers,
noise.
yeah.
Yeah, they
And a
teenagers,
toddler.
but they make a lot of noise. And you would now think they're not. You would think as toddlers going on
Oh, but that's good.
shouting and running down the hallway and stuff, but they teenagers.
But that's
and
good.
I love that.
Noise in the house, just
Yes.
excitement.
Yes.
Yeah.
Yeah. Yeah.
And when they're not there, then it's like
Yeah,
you
then
don't know
it's
what to
like
do.
quiet. And
And it's too
Yeah.
much freedom.
yes, yes.
Oh, cool.
Can I ask you, take us back to like your okay, your childhood, or let's say your teens, or you going into your adult years when you decided today, I think I want to become a nurse.
Mm,
Or was it something that you stumbled upon studying something else? You know that sometimes happens.
mm. Yeah, like I said,
Okay.
I wanted to do traveling
Mm.
and what do you call it? Modeling. You know, when you're young, you want to do
Air hostess and whatnot.
yeah,
and what-
stuff like that. So my mom said, no, you must study for something that you know you have a job.
Something
Yeah.
practical, yeah.
Every month you get a salary, fixed salary. So I told her I'm not going to be a teacher because my mom is a teacher.
Okay.
Or was one. So she said, why don't you do nursing?
Mm.
So I'm like, okay, let's do nursing.
It's
And
better
that
than
is
a
a-
policeman.
and that was it.
So inspiring.
Yeah, because with my mom, it was
Look,
really.
but it's a
Popular,
different
but
time now.
I'm just making fun.
yeah,
okay.
no, it's fine.
On that also now, no?
Yeah.
So like
Mm.
yeah, like when you was there ever a moment on the journey where you thought to yourself, oh,
Not
am I
worth
doing
it.
this? And then what kept you going?
Look, to be honest now, no?
Hmm.
That time I was really so partying and
Finding,
Okay.
let's say
You know,
finding yourself.
finding
yeah.
myself, yeah.
Yeah.
First year university at
Yes.
UWC.
It's always
And those years you had a lot of modules. I
Okay.
had like 14 modules. Two of it was majors. So I failed the one major. I
Okay.
special it. Didn't make it like with 3%. They didn't want to
Oh.
give it to me.
And sliding is not allowed in
Mm-mm.
university.
Yeah.
no, but
So-
also in the industry. You can't be a
Yeah.
nurse at must 3%.
So I lost the bursary as well
Oh,
that I
that's
got that
unfortunate.
time. Yeah. So I decided, okay, I'll do it over the one
Oh, the one that
That I
you
failed?
failed, yeah.
and take second year modules with it.
Mm.
But then it's like
It's a lot.
It becomes overwhelming. Yeah.
yes, and everyone that was with me is now ahead of me, and
Oh, so
it
just,
became a bit depressing, and so I just left it.
Oh.
And then I went to do other type of work, contract here, contract there, but not nursing. I was like against nursing and whatever.
Until it found you.
Yeah, and then like 7 years later, I decided, actually, me and my husband, we had a talk and said, why don't you
Why
finish
not,
this?
yeah.
Because you have this bursary hanging over your head still that you need to pay back. If you finish your studies,
Then you don't, yeah.
Yeah.
So might as well.
might as
Two
well.
birds, one stone, no?
Yeah.
Yeah.
So I
so
finished
did you
it.
so you overcame that hurdle, and then you just continued and whatever.
Mm.
So was there from that point on a moment where you were like, nah, this is not for me? In it, I'm talking about you in it now.
Mm.
Or you're like, you know what? It's actually
Not that
it's
bad.
actually not that bad.
Mm. No, I was like that. It's not that bad.
Mm. Okay.
Yeah, because I like to help people, you know.
It's inherent, yeah. It's in your nature.
And through that 7 years when I was still also finding myself, I could say, okay, now, I like helping
Doing
people.
good, yes.
And doing good. So
Yes.
maybe I must just do this. And it was fine. I liked it.
Okay, you were speaking about your I wouldn't say your mommy forced you, but
Mm-hmm.
your mommy guided you. Hmm?
Yeah.
She pushed you into your profession. You are raising 3 girls. Two of them are gonna go find their own direction now very soon. What do you think is the starkest difference between when you were raised and the time that you're living in now with social media and all these influences that can come from different angles? What are your thoughts on that?
I think, like me and my husband, we started now already, trying to rear our kids in that way of not too much social media. What do you want to do? You must think about it. My eldest one was at my work already.
To
not
just-
job shadowing, she had some assignments she had to do. So I could, because she wanted to be a doctor, then she wanted to be a vet, then a lawyer. So it's like different stuff. So as I was studying through the years, they, like the first two was there.
They could see the
They could see
trials
me.
and tribulations and all those.
Yes. And so I don't have a problem with them sitting with their books and stuff. Because
Okay.
I'm studying again. So they see me with
So you lead by example. Yeah.
yes.
Fantastic.
So I will think the difference is between that time with my mom. My mom was very protective over me, and I'm the youngest of her 4 kids, and stuff like that. And she
okay.
just want the best for me. So it's like, you're gonna do this, and
So
and that's it.
you set for a job for life. Yeah.
Yes. But for me, with my daughters, I would give them guidance. We have an open relationship, and I trust God it will stay that way, because it can change just
Like that,
and then they close up and don't tell you everything. So hopefully they will, when they say,
they
I'm
will keep
interested in this, okay, let's do research about it. and-
Explore it and whatnot.
Yeah.
Find out the pros and cons.
Yeah.
Do you think that you mentioned that now, and I'm thinking about us growing up, and also like, do you think one of the differences is also that we tend to give our kids a little bit more options, and I think you said something very profound to me now, which pointed me in the right direction. Is you said you offer guidance, which is not that strong.
You must do this.
You must do this kind of thing.
You
like,
must go study.
obviously, they shouldn't do certain stuff. There's certain stuff they shouldn't do. There's certain stuff they should do.
Yeah.
But we're leading with guidance is more of a, trying to just keep them in bounds and whatever. Pardon me, I think that's the most significant thing from back in the day. I would say us being raised and
There's more leeway. Man.
there's a little bit more leeway now. And I mean, you touched on social media also, and it's a scary place out there. It's a scary place today.
Yes.
We saw the video of this guy getting shot.
Oh, yeah.
I mean,
Everywhere.
those kind of videos and those kind of things. Where would you be able to see that kind of stuff? Because TV is censored.
Yeah.
Yeah.
You
But
want-
now we're living in a society where they don't only have access to all the nonsense that they're talking on the internet, the craziness on the internet. They have access to porn. They have access to these kind of killings and those kind of things. How do you shield them from like, what physical things do you do
information overload,
to
basically.
curb them from the harshness of technology?
So what me and my husband do, they don't get their phone during the week at school, unless there's some homework they need to check.
Yes.
And then we also, you get that apps, the parent
Yes,
guide or
to
something
track
like that.
and monitor the
Yes.
phones and whatnot.
Yeah.
whatnot.
And we do make a point of it, and they know it. We check their phones.
Yeah.
Anything off, you don't get it. And at the beginning, it was a bit hard for them. It's not like they were on the phone every day
But they
or
must get used to it,
weekend.
yeah.
They had their phones certain time of the day. And then when, I won't say punish, but discipline them, then we keep it away from them. Yeah, it was a bit, they were sad and whatever, but after they got used to it. So when you take the phone away, it's like, that's fine. Like they don't even ask for it like that.
But it also encourages communication between them.
Yes,
That
yes,
makes them more
exactly.
sociable, teaches them
Yeah.
social skills.
Yeah, and especially with a 3-year-old in the house, she wants to play outside.
Yeah.
So
Run
go
around.
play outside with your sister. You
I
know?
think that's nice. Ek hoop julle vang tips, mense. Asseblief.
Ja, dat
Asseblief vang tips. Sit met 'n boekie en 'n pen en skryf. I on the other end also kind of struggle with that. Like, my kid is now, my youngest is 2 years old. 2 years old now, yeah.
don't let your wife
Nah,
see this.
brother.
You sandals.
Don't make a big deal
Big
about
deal.
it. He's 2 years old. He's
Karma
2
like
years old. And
Chaos monster.
it's difficult to navigate with everything being on social media, not social media, on the phone and because I was sitting and thinking about this now the other day. Nothing. This is a very interesting discussion now. When we were younger, and you wanted to watch Aladdin or you wanted to watch
You
princess
wait
thing
till
is-
Saturday morning.
somebody had to put the VHS into the
You're
thing.
talking about VHS though. I'm talking about. I was thinking you talking about once a week the episodes come
Like
up.
even that, like nobody.
You didn't have access.
You didn't have access to things the way you do now, but now here's the kicker, is that they're watching Coco Melon and all this thing is, and Coco Melon you can not only watch on the laptop or on the TV
On the
or
phone
whatever, you
also.
can also watch it on the phone.
Mm.
So now I'm torn between, do I just give him the phone to watch a little bit of Coco Melon?
Or do we?
But then on the other hand, it's like the phone. You don't want him to sit too much with the phone. So then I'm torn between that. Like, you think I should do this or do you think I should do that? And you know what I do? I put it on the laptop rather on the laptop or something.
Everybody watch together.
Because then everybody can watch together. And if he wants to play, he can walk off. But when they have the phone,
So
it's like it's glued to his forehead, my guy. It's glued to his forehead. And then just to segue to something else, what are you studying now? And then before you answer that question, what exactly did you have to study before to become a nurse? For those kids out there that want to.
Okay, what I had to study, the curriculum changed, from that time when I was doing just my degree,
Yes.
from what they're doing now. So it's a bit different. So I can't actually give advice on that.
the specifics
You
you can't
see.
but the
Yeah.
overall premise should be the same. Eh?
Yeah. So you have to have your maths,
Mm.
your biology and stuff, but they have now different names for it.
Yeah, what
which
life
I
sciences,
don't- yeah, stuff
and
like
maths
that,
lit and I don't know what else is there.
Yeah.
Okay.
And that was for sister, the degree,
The
4
sister,
years. But you do get the 5 years one as well.
Okay.
So for me, it was that time I didn't have to do the 5 years one because my pass rate was my matric. It was
fantastic.
yeah. So I didn't have to do that
Lucky
extra
that,
year.
okay.
Yeah. So my 4 years included the honors. So I have honors as well.
Okay.
Oh.
Yeah. So after that, I've done the CNP course, clinical nurse practitioner. So that is 1 year
Okay.
that you do. It's a lot of work in 1 year.
Mhm.
It's not difficult. It's just a lot of work.
Okay.
Yeah.
Yeah. And it's very interesting for me. I love it. So they call us the mini doctors. So
Okay.
yeah.
Yes. You
Okay,
can
so
write scripts and do all
Yes.
those
I
things.
know exactly who
Okay.
Yes.
you are, the lady who comes to my bedside, does everything, without the doctor even having to see me.
Yeah.
Okay.
So we diagnose and prescribe as well.
So
Yeah.
okay, I have a question on that. Then why aren't you classified as doctors, as junior doctors maybe, or I don't know. If you have the powers of the doctor, I would assume to write scripts
No.
you
No,
don't.
there is a lot of things that the doctors do that we
Don't.
can't.
Okay.
We're not trained for that. That is why the doctors have 7 years of studying.
Yes.
Yeah.
Okay. When I went for the surgery a couple of months ago,
Yes.
the doctor that was there, the man didn't know how to pull blood. So I was thinking. But he said no, he
Because he doesn't deal with it.
that's not it's not my forte. So I had to wait like 3 hours for the specialist nurse to come find the veins and what, and it took like 5 minutes for. I was just thinking, if you're a doctor, doesn't it include all facets, but of clearly.
Because it's broad.
Yeah,
man, I
clearly,
think that's the
clearly,
thing. It's
yeah.
broad. I mean, medicine is broad. So in its totality, it's like who can do everything.
It is.
That's why they have the
specialists,
specialists in that. Yeah.
Teamwork.
Yeah.
That's team. It is.
And then I would just like for you to explain. So this camera will be able to. Okay, all the cameras can see. Just the epaulets and those little things on there, explaining what that gives you authority to do. Like, I am allowed
to
draw
test
your blood.
this.
I'm allowed
Can I
allowed
just say
to
no?
prescribe something and diagnose something.
Can I just say I didn't know that was called epaulets.
I think the epaulet is the thing, like
You-
the thing on the shoulder.
That's
Is
the
it?
maroon.
Okay, you
Yeah,
learn
that's the
something
epaulette.
old every day, no?
Mm.
Mm. Mm.
He's
He's ahead of himself.
No? Yeah.
You know why I know that? Why I know about epaulets? Because I'm in the security industry.
Okay,
And
okay.
the Owens were the epaulets, and I also know I've got family in security and
Yeah,
stuff like that. So I
okay.
know. I've heard, I've been around the grind. So if you can just go
Okay.
through those.
Okay, so this one, you see a lot of staff nurses,
Yes.
but their name changed now. It's not staff nurse anymore.
Those are the ones with the white.
With
no?
the white,
Yeah.
yes, and the white epaulet, then
Yeah.
they have this on. So which means you've studied 2 years.
Oh.
Then you get this. And this one,
Just talk to.
yeah. So the one, there's a green one, but it fell off. The green one is a midwifery one.
Okay.
So all of this that's on here, I did it in my 4 years. Yeah, kindersvang, yeah. And the yellow one is the what is the yellow one again? There's such a lot of bars. But is this blue?
There's a blue one on the.
So that is a general one. Like I can work all over in the facility.
Okay.
Yeah.
That is-
Dressing room,
Oh.
drawing blood, working in trauma area, putting
Trauma?
up drips,
So
a lot of things. That's general.
So
you know?
that's basically general service now. So you
Yeah.
everywhere.
Yeah. And then the yellow one is the mental health one.
Oh.
So
Nice.
you do get advanced mental health, which we don't do. That's a speciality on its own.
Okay.
So we just do like the basics of it in your 4-year course.
Okay.
Yeah, but that is a module that you have to do.
What would be the basics, if I can ask, if you still remember?
Yeah, I still remember. I still do sometimes mental chronic
Okay.
patients. I see it. Some of them have mental health who is on medication for it. So you check their overall
Wellness.
attire, their wellness, how's the thought, going the thoughts, are they sleeping well, they eating well, how's the appetite, stuff like that. Are you hearing voices? Are you seeing things that other people don't? Stuff
Yeah.
like that.
Okay.
You have to ask them. You can't just assume.
Yeah.
They're sitting in front of you, they look fine, but they're not fine.
Up here, it's like
I have one more follow up. Just what would be, say, give 3 warning signs for our audience? What would be 3 warning signs for somebody who's studying, who's struggling with mental illness or needs help mentally?
isn't it like mental health month or something? Oh no, it's on the radio now. The other day I heard them. They were talking about suicides and stuff like that. Sorry to have jumped into your question. I was just thinking about
3 things. I would say if the person is struggling with mental health issues, you need to tell someone. If you feel that you are suicidal, you want to hurt yourself, or you want to hurt the next person for no reason, you need to tell someone about it as well. And if you feel that, you just want to sleep all day, you don't feel like going out, you don't feel like eating, there's no list for nothing. You need to tell someone.
Okay.
Because, that's not normal.
Fair
You
enough.
need help.
Fair enough. But okay, for me personally, I feel in our communities, 'cause I've worked in the communities a lot, there's a stigma attached to stuff like that, which I don't want to say makes people scared, but it makes them repress that. So they will rather fight and lash out than to speak to somebody about what's happening inside. So how do we break past that, basically? Is there a way? Can you even do that? Or must the person be willing?
You see, the thing is there's stigma around that as well, mental health.
Especially in the colored community.
Yeah, so you don't want people to think, because mal, whatever. You don't want that. So there is at the facilities, the clinics, and there's social workers, there's counselors, that you can approach. They don't know you, but they're there to help you.
Yes.
Okay.
You can do that if you don't trust anyone,
That's
family
in
or
your
friends,
orbit.
whatever. You can come to the facility and you speak to the social worker.
Okay.
or one of the counselors. No matter.
Yeah, guys. Yeah, social workers, counselors.
And I mean, you say the stigma, and have been in that place in my life already. I know it's on the outside. Everybody says like, "Sy kan me gesê het," of you could have said this, you could have said that. So it's difficult when you're there to reach out, or even if people is reaching out to you for you to be like, okay,
yes, I need help. It's
tough to admit it.
difficult. Yeah.
People is like, nah, di bara small. But I think and this is the reason why you were here on the show. It's because there's a lot of conversations that we're not having.
Yeah.
I know we sometimes talk a lot of nonsense and stuff, on the podcast and like in general, no. But the reason for the podcast is to add value, and we try to remind each other of that all the time. Like, as long as we're adding value, you can't go wrong. And be the light in the world you want to see, kind of vibe. So
very Michael Jackson.
but it's what we're here to do. So I want to do. It leads me to the question of how important is not only family, work-life balance, and all the other things that we do, but how important is faith, or more specifically, God in your journey and your everyday life.
Very important. For me, God comes first. Before my husband, before my kids, before anyone else. God is like like I'm chatting to you.
Yeah.
When I get up in the morning, I say, "Morning,
the
Lord," and
conversation,
I start my conversation, and if I see I'm late, I'm like, "Yo, just please help me to get done in time," and like that.
Okay.
And sometimes when I'm too late, I don't get time to have my prayer session at home. Then I'll just do it on my way to work in the car, because I'm alone in the car.
Oh,
Yeah.
Play gospel music.
have a nice conversation.
Yes, and just gaan te kere, and stuff like that. So my relationship with God is very important to me. I have to check in
Yes.
with Him, with everything. Doesn't matter how small, how big. Even for this, I'm like, Holy Spirit, please,
Yeah. Lead me.
And
That's beautiful, man.
because you would now think, it's something simple, man. But it's not like,
the internal pressures, the
Yes.
anxiety.
Yes. And He says in His word, know me in all your ways.
Yeah.
That is all your ways.
Mm.
So I'm doing that, and I'm, trying to stay on that and rear my kids in that way as well.
Yes.
And, very important. You only know who they are when they're in the house, when they're at school or with the friends, you don't know. But you
Yeah.
trust in God.
That they're making the
Yeah.
right decisions.
Yeah.
Try to do your best while you are around and they're all listening. I think that's good and great, not just good. It's important for I think everybody everywhere to at least believe in something. No?
You have in our
To
power.
at least believe in a higher power. I mean,
Something
you
bigger
can't
than
choose
yourself,
you can't choose someone else's faith and religion. But at the end of the day, to still have something just to cling on to, and something that just to uplift you, and like you said, for guidance and that kind of thing. I think it's very important not to go into religion and all those other facets of things. But like I said, the podcast came about with personal development. So even if there's a person on the show that has that we had a guy speaking about music and that kind of thing, there is people that wants to become sound engineers. And the music industry maybe has a little bit of other crazier things with it and so forth. But at the end of the day, if we don't have these conversations, if we don't speak to our children about the stuff, they're gonna walk around blind. So better them hear it from us, where it's constructive and it plays a part in their life. Where, like you said, when they go out there, and they do whatever they want
Because
to. On the quad, they scream and they go crazy there. But
speaking from experience, I was an angel.
but you see, but the thing is, if you've seen abuse and those kind of things in your house, it would have been normal for you to do it outside. So those conversations, these kind of things, it all plays a part
Fair
in,
enough.
in it.
Okay, I have
It
another
is,
question. What? I didn't say what question. What topics or which questions do you think needs to be more prevalent in our communities? What is a topic that you think we need to speak about more? It needs to come up to the light. It mustn't just be spoken about in dark corners when there's nobody looking around.
Okay. There's quite a few things.
We don't have to go deep.
But
We don't have to.
I think something that that if I look at my workplace, what I see, and on a Friday I go out, I do home visits. That's
Okay.
now the
Wow.
bedridden patients at home, and
Okay.
the frail and
The
very
people who
old,
can't
and
move, yeah.
they can't come to the facility. Then I go out, me and
That's nice.
other colleagues of mine. So and what I see in the communities and people's houses and stuff, it's sad, man.
Yeah.
You know what you see, and then you're just grateful for where you are in your life. And
Yeah.
your problems doesn't matter.
It seems
At-
small in
at-
comparison. Yeah.
Yes. And then I see a lot of young, like girls,
Young
know,
woman now.
young. They're supposed to be on school, high school, but they're not at school. They on the streets and whatever. And in the facility, there's some of them when they come for whatever the reason, and then they're now pregnant and they don't want a baby, so you need to refer them. Stuff like that. It's hard so for
it's
me, man.
heartbreaking, yeah.
Because I feel like to have a child is a blessing from God.
Yeah.
No? And I do understand that for some people it's too tough at home.
Yeah.
Yes.
They can't
The pressure is
afford
too
a
much,
baby and things like that. I do understand that. But when I think of, okay, it's now, how many times have you been coming now for this, And then I'm thinking, okay, so why are you not on family planning?
It's
You
being
understand?
used as a contraceptive.
As a contraceptive, yes. And that is not right.
Yeah.
Because in the first place, it messes up your reproductive
Yeah.
system.
Mm.
So one day when you settle down, you
actually
have your
want-
husband, you want to have the baby, now you have problems. You can't conceive, things like
Yes.
that.
Oh,
And they don't think that moment
Yes.
in the future.
long term now.
Because they're so young, like they're not mature enough to think that way. And even if you tell them that, it's like,
in the one right out by the outside.
yes, it doesn't even go in. It's just like
I think
past the
yeah.
head. Yeah. So that was something I was that was heavy on my heart about because I see it frequently, man.
And
I
again,
can imagine. Yeah.
It's one of those things that we're not speaking about it enough, man. Like I mean, like you can stand on the rooftop and shout, but if people don't want to listen, they don't want to.
That's the thing.
So again, it starts in the house, like you were saying.
It's a lack. I think it's a lack of education from the parents right through. Because the parents would tell you, okay, condoms, this, that. Because now you're gonna every time you get an abortion, I'm assuming
That is a heavy thing to speak about. If you think about it, it's very taboo to sit with your kids and have that conversation.
speak
The
about
birds and the
Yeah.
bees and whatever.
but even finances also.
Even finances. We had the Taryn on also, who is studying psychology, and that's one of the things she said. Finances. How do we buy a house? What is a bond? How do
All
we?
those things, yeah.
and
How do we pay rates and stuff like that?
So I think we using this platform as like a
Information gathering.
information gathering, like you said, yeah. I want to ask you this: in your experience, for work wise, and just in general, do you think that abuse is more prevalent in the poorer areas or in the more affluent areas? Abuse in the house.
I think it's the same.
Mm.
because what I've seen,
Yes.
because I've been working in different areas,
Yeah.
facilities and stuff like that. I've worked in town, the city. I've worked, where I am now.
Yeah.
So you see the same thing all over. It's just
Different
The-
shades.
yes. So I would say the more, I won't say rich people, but it's much more quiet there. Like you wouldn't know about it, unless something now happened.
Yeah.
So something
know,
gets shot or something.
Yeah,
like that.
and then they end up now there at your facility,
yeah.
or whatever the case may be, or the type of medication that they are on, and
You
you
can
dig
see,
deeper, then you hear, okay, this is what
Mm.
happened, whatever. But with the poorer community, it's like it's
Everybody
in your
knows,
face.
yeah.
You know?
It's,
Yeah.
the auntie around the corner. So, yeah, it's a scene.
En
Yeah.
almal is en almal se
Ja.
besigheid.
Yes. So
Mm.
it's actually the same. It's just more covered up on the other side.
And that's what happens
Which
when you
kind
have
of makes
money.
sense, no? I'm sitting here and initially my thought was that it's more in the poorer communities. Because people struggle and they fight when they struggle.
The pressures and anxieties and
But I think it makes so much sense. It's just that it's more quieter. It's more undercover. And especially the people with so-called status. You don't wanna make the family look bad.
Yeah.
you don't
So
wanna be
you being
classified
abused,
as a
but you don't
victim,
wanna say it.
But
Yeah.
also, I think in the more well-off situations, there's different forms of abuse. So in the poor communities, there will be physical. You will know physical, but in a rich family, it will be financial abuse, emotional abuse. I wouldn't say services, but certain perks get taken away
Yes.
to make you conform to something like that.
I don't know. I think
if
it's
that makes sense.
I think it's both ways. I think
Yeah,
it's
look,
because
like, either way, abuse is abuse.
abuse is abuse is abuse. Yeah.
Simple as that.
Different degrees of abuse, but it's still a terrible thing.
Mm-mm.
So you go to people's houses and you do the what do you call that?
Home-based caring.
Okay, you do
It's
your
not
Not
the
home-based
same.
caring. Home-based caring is somebody come every day, or they live on the premises and they take care of that person.
Yeah, or like at our areas, the home-based carers, it depends on what the patient needs.
Okay.
If they need a bed wash, they come like 3 times for the week, stuff like that. It depends on the situation at home.
Yes.
They also go out to give physiotherapy to the patient, speech
Okay.
therapy.
I've seen it. They do it a lot at the old age home. Where they come out, they exercise with the old people, do massages and stuff like that.
Yeah.
Okay. Yeah.
So what I do, I go check their vitals. So we take all our equipment with.
Okay.
Okay.
So we check the blood pressure. If you're diabetic, we do that. The finger prick or check the sugar.
Yes.
We check the well-being of the patient. Are they wasting? Are they
Ah,
eating
okay.
properly?
Yeah.
Do they need nutrition? Because then I need to discuss it with the dietitian and get stuff written up for them, and then the family must come fetch it. Do they need do they have medication? Does it get delivered every second month as it should?
Yeah.
If not, I need to sort that out as well. Does the family need support? Then I need to discuss with the social worker, is there any elderly abuse going on? Is there any bed sores that the patient have? Are they turning the patient? And that we need to check all that stuff. If it's something where for example, I see the legs are maybe swollen. When you
water retention, yeah.
check for that as well. If there is, I need to
Kidneys
discuss with
and
doctor.
Yeah.
Listen, I've observed this and this and that. This is the medication that the patient is on. What do I need to do? Doctor give advice, because the doctors don't go out. They don't go visits.
I just want to read it off the chart, yeah. Off the
Yeah.
report.
So then I do what the doctor instructs and we sort it out.
Yeah.
If it is a case where there's nothing we can do on a primary level, then we need to refer the patient to secondary level. And we do that as well. If they don't have transport, we need to organize
the
with
transport.
HealthNet.
Okay.
They transport the patients from the house to the hospital and back again.
Okay.
Like that.
Okay.
So it's quite a few things,
I'm
Yeah.
actually listening now. It's quite intricate, eh?
Yeah.
There's a lot.
Yeah. A
Yeah.
lot of facets to it, yeah.
Yeah.
my last question that I have. We were speaking about your profession now. What has been the most overwhelming case or overwhelming day that you've gone through in your professional life?
Mm.
What were the day when you were just one of those?
Bring me out completely.
Yeah.
There's quite a few.
Mm. Your top two.
Okay. This the top one for me now. I wasn't a CNP yet. I was a PN, like a normal sister.
Okay.
I worked at retreat.
Okay, yes.
Yeah, I worked in trauma.
Mm.
And a mom came in with a 8-month-old baby that was burned, like with fire.
Yeah.
And baby was wrapped in a duvet and put the child on the bed. They're so close, like totally close. And there's no expression on the mother's face. And I'm like, yo, what's that smell? It smells like burn. And when we open the blanket, it's just, like coal falling.
Oh.
The child's skin is just black, black, black. But the child is alive. And so we had to can't get the vein because it's all
It's
black.
gone,
You don't
yes.
see, and it's
And the
hard.
baby's crying.
And
Is the baby conscious?
baby's crying, but can't really move
Of course, it's
the mouth
burnt.
and whatever.
Oh, God. No.
And sorry, man, this is not
No,
really
no, no.
horrific.
No, this is
And so then doctor had to go straight in the bone to put in the vein, a drip. And the mother was just sitting there, expressionless. And we asked her what happened. She's just calmly telling us what happened. And it doesn't make sense.
Ow.
So there's no burn, scratch, nothing on the mom. But the child looks like that. So, like,
Story doesn't
it
add up.
doesn't add up.
So what did she say?
She said she was she lives in a windy house and there's a what is that gas
Oh, the paraffin
stove,
lampy
yeah,
thingy.
and she was gonna make food and she left the pot on and that, and the baby was apparently sleeping on the bed. And then she went out to go call the 2-year-old that's playing outside, and when she came back, the whole thing was burning.
I already
So
see
I'm
so
like-
many holes in there.
Yeah, it doesn't make sense. But with cases like that, you have
You
to
have to refer it.
get in the
Report it,
police
yeah.
and stuff like that.
Wow.
And I don't know what happened to her, but the policeman said that
That's-
it doesn't add up and
that's
they're going to
crazy.
charge her.
You have to be.
And they took her away there. The baby passed away eventually, was still alive like for 2 hours.
But I can imagine
Yeah.
first degree.
Yeah.
Was it the third degree is the worst? No? Third degree burns is the worst. Fourth
Yeah,
degree.
4th degree.
Fourth degree. That is when
So that's like,
when it penetrates the
yeah,
the
right through.
muscle.
Yeah.
That sounds terrible.
Yeah, it was horrible. It was.
Yeah.
Baby,
Oh, sorry,
doctor
man.
still referred the child, we phoned the ambulance and that. But doctor was like, yo, can't the baby might just, let go because it's so,
so hot.
I can just
But
imagine
yeah,
Yeah.
the pain and all of
Yeah.
those things.
I've had oil burn from hot chips. That
Mm.
is
Already.
that's already terrible.
yeah. And then the second thing, it wasn't how horrific.
This what in
Yeah.
the fridge?
God damn. Yo, thank you. Okay, okay.
It's okay.
That's fine. Leave it, ma. Leave it.
But you can
You
ask
don't
me
wanna-
what's inside or something. They can like,
Okay. Either way, that was also gonna be one of my last questions
Yeah.
was in the ER,
Mm,
like in the emergency side of things, what was like the worst
mm,
thing that you've seen there? I think that is like
Yeah.
that's a tough.
Yeah.
Yo.
that's a crazy one.
yeah, there's the other one I want to tell you
Go
about.
for it,
Let's
go
go
for
for it.
So there was a guy, a gangster, was
Mm.
shot like multiple gunshot wounds.
Yeah.
In his face also. Like, so the jaw was like
Gone.
shattered. No?
Oh my.
It was still there,
God.
but the bone was now shattered. And
Mm.
his vitals, or let me say his blood pressure and his oxygen levels, is just like,
Everything's
it's diving
Mm,
like very
Yeah.
fast. And doctor was struggling to tube in,
okay.
To put
Yeah, so then I had to like keep the jaw, like
Keep it together.
keep it
And
together.
you now involved in
And
this.
doctor now struggling to, open the airway
Yes.
and get the stuff in or whatever. But eventually we got it right.
there.
And the
Wow.
blood pressure stuff came up again. And then he was just he was stable, waiting for the ambulance. If he passed on there,
That's-
I don't know.
that-
Yeah.
Yo, that's madness. That
That does sound crazy. You know what, no? I don't know. I don't think I'll be able to stomach it. Pause on the Lauren, please. I don't know if I'll be able to stomach that kind of thing. You know, it's like one of those things you want to look but you don't want to look.
Okay, let's
look,
can we just switch it up? We ended on what is one of your more positive memories of being in the air? Because we went super dark now. Yo. We went super dark.
Positive memories. There is
Uplifting.
uplifting.
Mm.
There's quite a few also. When you've seen patients going through things or whatever happened to them, and you see, okay, now they're doing better now. They're
actually-
looking better. There's
yeah.
some color in the face.
Yes.
Oh. Okay.
Stuff like that. It's a nice feeling. Or when they come back to you and they tell you, sister, thank you. I was here the other day. Maybe you don't remember me, but you did this and
Yes.
this and that, and I appreciate it. It's
It
nice.
makes you feel.
Yes.
I always say thank you.
I don't expect that from them because it's my job to help
Yeah.
you.
Fair
It's
enough.
not like I'm doing something extra.
Oh, yeah, you're just doing what you do.
Yeah.
That's the thing.
And when they say thank you, it feels nice. It's a satisfaction
Yes.
that you get. And yeah.
To you,
like it.
it might not seem extraordinary.
Mm.
To you, it's normal because you deal with it every single day. But
Yeah.
Superheroes do what superheroes
no,
do.
superhero's gonna superhero.
Yes.
Yeah.
Cherice, thank you very much.
Yeah, this
thank you
was-
very much for coming through and telling us all your interesting stories.
Mm.
And
I think we will
spreading
definitely
that
have a-
love and value.
We will definitely have a part 2 at some point.
Yeah.
This was
Come again and come tell us some more crazy.
we're gonna get deeper next time. On your all the nitty gritties.
And yeah, it was interesting to hear that part
I've
of you. Was nice sitting down and chatting.
That's nice. Yeah.
I've never gotten this perspective from a nurse yet. From a sister. Sorry, put it now.
Doesn't matter.
Clinical nurse
There we
consultant.
go.
There we go.
I've never
Butchered that a
never
few
been on
times.
this side, but I speak to sisters every day.
Mm.
But they've never given me information like epaulets. Tomorrow at the Alice is yours. What's
Like, wow, look,
what's
you are
on
like
your
your
epaulet?
epaulets. Look at your epaulets.
I walk through
Everybody has
I walk through the whole hospital tomorrow and I say, hey, nice epaulet. Ooh, you got 3. Ooh, yeah. Now they know
Thank
what
you very
it
much for
means.
tuning into this episode of Put It By The Wall. Like, comment, subscribe, and all the
There we
beautiful
go.
stuff.
All
It
here
is
at
the
the bottom.
best way you can show your support. Thank you.
If
very
you
much.
guys do want to reach out to Cherice, her number will be in the description.
Why would they want to reach out to Cherice like via the number? Think about it.
Why not? She's a nurse that knows stuff.
No, what you can turn it into like a what do you
Obviously,
call
can't
it?
put her actual number there.
Tyler nurse.
We put the hospital's put the hospital's number or the hospital's email or something. Yo, you must pull the whole outro here. Never
Gonna put
mind
the
that,
people's
guys.
personal
Never mind that.
details
It's
out.
gonna be edited out there.
Bang bang.